Today we will discuss about the fourth ventricle, which is one of the most important topic of our neuroanat. So let's discuss what is fourth ventricle. So fourth ventricle is a cavity of the hindbrain, cavity of hindbrain, and in hindbrain, cavity of hindbrain. In hindbrain, we have three parts, which pons, medulla oblongata, and cerebellum. So, cavity of the hindbrain is known as fourth ventricle. We have hindbrain three comprises of three parts: pons, medulla oblongata, and the cerebellum. So, if we see in front, if we see in front we in front cavity fourth ventricle in front have pons and medulla, upper part of the medulla. Behind we see cerebellum. In similar way, we can see that anteriorly, if we see the sagittal section of the fourth ventricle, we can see like this. Anteriorly, we see dorsal part of pons and medulla, and posteriorly, we see ventral part of cerebellum. Ventral part of cerebellum. So, what is fourth ventricle? Fourth ventricle is a cavity of the hindbrain. Hindbrain comprises of three parts: pons, medulla oblongata, and the cerebellum. If we see the sagittal section, we can see all this in sagittal section. If we see the sagittal section, we can see the in front we have pons and upper part of the medulla. Behind we have cerebellum, and the anteriorly we have dorsal part of the pons and the medulla. Posteriorly we have the ventral part of the cerebellum. So, if we discuss about the lateral boundaries of the fourth ventricle are divided. For we see first superolateral, which is made up of superolateral. We see superior, cerebellar, peduncle, and inferolateral. We see gracile tubercle and cuneate tubercle, and the inferior cerebellar peduncle. So, lateral boundaries first is our superolateral, second is inferiolateral. Superolateral is formed by the superior cerebral peduncle, and the inferiolateral is formed by the gracile tubercle, cuneate tubercle, and the inferior cerebral tubercle. Let's see this all in diagram. So this is our fourth ventricle. Mainly in this diagram we have they have seen the boundaries and the floor. Floor we will discuss afterwards. So boundaries we have two: superolateral and the inferiolateral. This is our superolateral boundary, superolateral, and this is our inferiolateral boundary. So the fourth ventricle is somewhat diamond-like structure. Superolateral we can see it is lined by superior cerebellar peduncle. So this is our superior cerebral peduncle, superior cerebellar peduncle, and this is our inferior cerebellar peduncle. Mainly this part is known as medulla, and this is known as pons. This is known as pons. This is medulla. Hmm. And in medulla, when we go from medial to lateral, this is our gracile. This is our gracile. This part is gracile fasciculus, and the upper part is a tubercle. In same way, this is our cunate fasciculus, and this upper part is cunate tubercle, and the lateral most part is the inferior cerebral peduncle. So medulla is divided in the lower part in the lower portion into three parts. First, remember that we are talking from medial to lateral. Medial most part is the gracile fasciculus and the tubercle. Upper part is the tubercle, lower part is the gracile fasciculus. In same way to cunate fasciculus, cunate tubercle, and this is our inferior cerebral peduncle. These all forms our lateral boundaries of fourth ventricle. Now we will discuss of the floor of the fourth ventricle. So floor of the fourth ventricle is somewhat rhomboid fossa. Rhomboid fossa, because it has a shape. Rhomboidal shape. It has a first upper part is a upper part. First is a upper open part of pons, and second lower closed part of medulla. If we see the parts, our floor is divided into three parts. We will see all this in diagram. First, let's know what are the parts. So three parts. First is a upper triangle. First is the upper triangular part of pons. Second is the lower triangular part of medulla. And the third is the intermediate fibers called stria medullaris. Stria medullaris. So, our floor is mainly of three parts. First is the upper triangular part of pons. Second is the lower triangular part of the medulla, and in between these we have intermediate fibers of stria medullaris. So let's discuss this in the same diagram first. This is a upper triangular part. This is a upper triangular part. This is a lower triangular part made by the medulla, and that blue line, it is known intermediate fibers, which is stria medullaris. Now we will discuss about some features of the floor. These are the most important features. First is our dorsal medial fissure. First is our dorsal medial fissure or sulcus. And we will have fasciculus, facial colliculus. Facial colliculus. We see all these in diagram only. So first is dorsal medial fissure or sulcus, and second is a facial colliculus, and third is medial eminence. Third is vestibular area. And we have two fossas. Fossas or fovea, we can say. Superior fovea and inferior fovea. We have sulcus limitans. Sixth, we have area prostroma. Area prostroma. We have two triangles, hypoglossal triangle and vagal triangle. Let's see all these in the diagram. So features of the floor are, first is a dorsal medial fissure or sulcus or facial colliculus, medial eminence, vestibular area, superior fovea and the inferior fovea, sulcus limitans, area postroma and the hypoglossal triangle and the vagal triangle. So this is a structure of the floor. So first there is a dorsal median sulcus which divides the floor of the ventricle into two parts. This is our dorsal medial sulcus. It divides the floor of the ventricle into two parts, first part and the second part. Now we have the facial colliculus. This is our facial colliculus is this. It is in round elevation. Facial colliculus is round. Facial colliculus is round elevation. We have abducent nerve, abducent nucleus. This structure is elevated because deep down present is abducent nucleus, and around which there is a loop of facial nerve. Around this there is a loop of facial nerve. So facial colliculus is a rounded elevation, and deep down we have the abducent nucleus loop which have a loop of facial nerve. Second, we have discussed our medial eminence. So the dorsal median sulcus divides the floor into two parts. That's the medial eminence. This is part is the medial eminence, and the second part is the vestibular area. This is our vestibular area. Somewhat vestibular area lies in the pons region, and some lies in the medulla region. This is our medulla, and this is our pons region. And the medial eminence. Upper part is medial eminence. Upper part is broad, lower part is somewhat narrow. So there is a sulcus limitans. Sulcus limitant is this. Sulcus limitant. The sulcus limitant joins the superior fovea. Sulcus limitant join the, this is our superior fovea and the inferior fovea. And the superior fovea is present laterally to the facial colliculus. We can see this is our facial colliculus, and superior fovea is present laterally. This is laterally to the facial colliculus, and above the superior fovea. Above the superior fovea, this is a locus ceruleus. Locus ceruleus is a bluish part होता है. Locus ceruleus is a bluish part. Locus ceruleus. Locus ceruleus is a bluish part. The blue is due to the presence of pigmented. Blue is due to the presence of the pigmented neurons of substantia ferruginea. Of substantia ferruginea. So the locus ceruleus is the bluish part, and the blue part is due to the presence of the pigmented neurons of the substantia ferruginea. So we have discussed the dorsal medial feature, facial colliculus, the elevated depression, median eminence, vestibular area, superior and the inferior fovea, sulcus limitans. Now we will talk about the area postrema. So first, let's see the uh, triangles. This is a hypoglossal triangle, and this is our vagal triangle. Apex is downward and base is upward. So the area present between the lower part of the vagal trigon and the inferior cerebral peduncle, and the inferior cerebral peduncle is this area. This area is a area postrema. This area is a area postrema. So this is a site. This is a they have chemoreceptors. Area postrema have chemoreceptors present, and this also lack blood-brain barrier. This also lack blood-brain barrier. So we did discuss all the points of the features of the face floor. This is for upper part is the midbrain part, which have superior colliculus and the inferior colliculus. This is a part of the midbrain. We will discuss this in the midbrain. So these are all the features of the floor. Now we will discuss about the roof of the fourth ventricle. So roof we have two parts. First is the superior part. Second is the inferior part. So superior part of roof comprises of uh, two main headings. First is the superior cerebellar peduncle, and the superior medullary velum. Inferior part we have telacordia, what is telacordia? Telacordia is a double fold of pia mater. Double fold of pia mater. See this in diagram. See this in diagram. The superior part, this is a diagram of the roof of the foreventricle. The superior part is formed by the superior cerebral peduncle, and the area where the right and the left superior peduncle meet is form the superior medullary velum. So this is the superior part, and if we talk about the inferior part, inferiorly we see telacordia. Telacordia is a double fold of our pia mater. Here we can see this is a telacordia. This is a telacordia. This structure is telacordia. This is in between the double folds of the pia mater. Double folds of the pia mater. So this is formed. The inferior part is formed by the telacordia, and we have discussed the superior part, inferior part, and now we will discuss about the communication of the fourth ventricle. Superiorly, it communicates with the cerebral aqueduct. Inferiorly, it communicates with central canal. Superiorly, it communicates with the cerebral aqueduct, and inferiorly, it communicates with the central canal. This, let's see, this is a diagram. This, the superiorly it communicates with the cerebral aqueduct, and inferior we have central canal. Openings in the roof. We have two openings. First one is a foramen of Lashka. And the second one is the foramen of Mendai. So we have two openings. First is foramen of Lashka, and second is Mendai. So these two foramen of Lashka and the foramen Mendai communicates with the fourth ventricle. Communicates with the fourth ventricle to the subarachnoid space. Fourth ventricle to the subarachnoid space. We have we have already seen the fourth ventricle is a diamond shaped structure. So this is our superior angle, this is our inferior angle, and this is our lateral angle. The green one is a lateral angle, and the blue one is an inferior angle, red one is a superior angle. Superior angle we have is communicates continuous with the cerebral aqueduct. Inferior angle communicates with the central canal, and laterally we have inferior cerebellar peduncle. So we have three angles. The red one is this is our superior angle, this is our inferior, and the two other lateral angles. Superior angle continues with the cerebral aqueduct, inferior angle continues with the central canal, and lateral angle communicates the inferior cerebral peduncle. Now we will discuss about the cavity and the recess of the fourth ventricle. We have seen this have five cavities. Five cavity or the recess of the fourth ventricle. First one is our two lateral dorsal recess. Second one is two lateral recess, and third is one is our median dorsal recess, which is which is present in between the two lateral dorsal recess. This is not asked in exam, so only names are important. This is the first lateral dorsal recess, and this is second lateral dorsal recess. So this is all about our fourth ventricle. There are 5 cavities or recesses of the foreventricle. 2 is a lateral dorsal recess, 2 lateral recesses, and the 1 is a medial dorsal recess. Angles are 3: superior angle, inferior angle, and a lateral angle. There are 2 openings, foramen of Luschka and the foramen of Magneti. Communication: superior communicate with the cerebral aqueduct, inferior communicate with the central canal. So this is all about our fourth ventricle. Thank you.